Hi everybody, I'm Dr. Jon LaPook. Welcome to cbsdoc.com. Last weekend I was up in Vermont on vacation and I heard there was going to be a town meeting in Arlington about healthcare reform. So I grabbed my video camera and went. Take a look.
Good afternoon, I'm Senator Bernie Sanders and welcome to a Vermont town meeting. Jen has been a registered nurse for 21 years.
How many of you here have yourself or know people who have put off health care because they were afraid that it would cost too much? Raise your hand. All right, quite a few people are raising their hands, and I've been fortunate enough to have good jobs with good health insurance, and I've been paying into those, paying my premiums and paying my co-pays. And now that money that I paid in all those years is being used to create ads and things that you're reading in the paper that aren't true about our current healthcare system. And it's about time that we as people thought about the fact that this is a moral issue. What's happening to the people in this country, the people who don't have millions of dollars to spend on newspaper and TV ads, they're suffering, having pain, and even dying.
Right now we're in the midst of a major recession. We have 9.5% of our workforce is unemployed. One of those unemployed workers is an iron worker from northern Vermont, Dave Kaczynski. And Dave, why don't you say a few words about your perspective as an unemployed iron worker?
Thanks. Hi everybody, my name is Dave Kaczynski. I'm a 21-year iron worker. I'm a single dad. I'm a 20-plus year Vermont resident, and I'm also an insulin-dependent diabetic. The last job I was on, our health care cost was $7.20 an hour out of our package. That's what it costs for us to have health care. And again, the last job I was on was 2 hours and 15 minutes from my house in Leominster, New Hampshire. I was happy to be putting up a beautiful windmill project down there, and that was the last full-time job that I had. When I lost my health care, my diabetic supplies, if I had to buy them in the store, are $800 a month. I applied for VHAP, and I want to say I gratefully got it. And I got to say, it's I'm not the kind of person that likes to ask for help that way. I'm really not. I've been a proud blue-collar guy for a long time. I come from a lot of generations of blue-collar in my family, and it was a tough, but I don't have a choice about the diabetes, so I did what I needed to do.
Millions of Americans have lost their homes. They have lost their savings as the stock market plummeted. They have lost their hope and their ability to send their kids to college, put away money in the bank for years. That money disappeared. And millions of people like Dave Kaczynski have lost their job. In terms of health care, we have a situation that has to be dealt with. Not just because 46 million are uninsured. Not just because even more than that number are underinsured, including many of you, with high deductibles and high co-payments. It's not just that 60 million people in our country do not have access to a doctor on a regular basis, and according to the Institute of Medicine, over 18,000 die every single year because by the time they get to the doctor, generally in that story, it is too late. In this year alone, 1 million Americans are going to go bankrupt because of medically related bills.
I could not afford to pay out of pocket for a mammogram. The following year I did go because I did have some health care coverage, ended up being diagnosed as a stage 3B breast cancer. After I could no longer work and had no paycheck, I was told if you want to pay $252 every 2 weeks, then we will continue to keep you on our Blue Cross and Blue Shield plan. My husband is severely disabled from a car accident, and what he gets for Social Security pays our mortgage. My check covered my insurance and everything else. So to cover my chemo and to pay for my radiation, we used our savings, all of my retirement fund. We sold our plow truck, our boat, everything we had worked for so I could continue to have medical coverage. So for those of you who don't feel that health care is a human right, I ask you, do you feel that it's a human right to die because you can't afford insurance?
I grant you we need some type of reform, but we do not, I don't understand why we need a system for everyone when the Vice President's task force report has a certain type and class of people that need this. I have difficulty understanding why we need it and why we have to rush.
How many people here believe that health care is a human right and should be available to all people? Raise your hand. Okay. How many people do not believe that all Americans should have health coverage? Like, should the government make sure that every American has access to health care? Who wants to? Okay. All right. In my view, I think the majority of the people here feel that. Not everybody.
We'll be right back after this word from our sponsor.
I have no faith that the government will be able to manage that when I see that they have not managed my Social Security, they have not managed my Medicare, they have not even managed the post office.
I'm a nurse. I work in Bennington for an internist primary care physician. People really need to know that physicians, especially primary care physicians, get paid very little money. Very little money. I can tell you for a fact that 60% of our patients are Medicare patients, and for a blood draw, he gets paid $2.50 for what I do. Okay? Sometimes it takes a long time to get that blood. He could not be here today, and so he asked me to relay this to you. Please tell him for me that getting insurance for everyone won't matter without payment reform that encourages good primary care and prevention and stops rewarding, encouraging only volume and procedures.
I praise God for people here who stand on principle and not depend on government, but depend on the freedom of American people to make life good for themselves and their community. God bless America.
How many people think that we should not abolish Medicare? My point is, one of the funny things that happens when you're in the Senate is you meet a lot of people. And people come up to you and they say, get the government out of my Medicare. Medicare is a single-payer government health care system. That's what it is.
Are there aspects of our system which are really the best in the world that we would want to be sure we kept?
So there are some things that we do in the system. We have, some fantastic physicians who are the envy of the world. On the other hand, our weakness is that we are the only nation in the industrialized world that does not guarantee health care to all of its people. We're very weak in primary health care, as I think we have talked about here. Many people don't have access to a doctor or a dentist on a regular basis. I think we do not do a good job in disease prevention. We spend a fortune on chronic diseases like heart disease, cancer, diabetes, but we spend a tiny, tiny fraction of that trying to prevent people from coming down with those diseases. We've got to do better than that.
I think we can work out something that is not government run and a single payer system. Universal health care is not going to work.
The point of the public option is to keep the private insurance companies honest, so that they can't just raise their rates off the wall and then tell people that's the way it is. Nobody, not any member of Congress, not you, not anybody here, is going to be forced to take the public option. It is an option.
I will go along with your health plan if you can promise us that you and your family will enroll in this plan. And if not, can we enroll in your people's plan?
Excellent question, and the answer is absolutely yes.
For most hardworking Vermonters, the idea of a free ride, we resent. But as somebody without health insurance, I'm not asking for a free ride. I'm just asking for an affordable ride.
Hi, I'm Lydia Broderson from Shasberry, Vermont, and there are a lot of people talking about universal health care and how we all want it, but to me, government and bureaucrats are writing it, and that's what I have a problem with, specifically with the bill, the H.R. 3200 that's in front of Congress. Have you read the entire thing?
No, because I'm not in the House.
Okay, well, it's getting ready to come to you, so be familiar with it, please. Page 430. Lines 11 through 15, the government will decide what level of treatment you will have at the end of your life. It is in that bill.
No, you read it. No, it's not in that bill.
Okay, I can bring it to you afterwards.
No, you bring it to me after. That is not in that bill.
Okay, page...
Sarah Palin notwithstanding, that is not in that bill.
Sarah Palin look at page 430 of that bill when you get it, Senator?
What you're looking at is something that is complicated, it is 1,000 pages, and it is subject to misinterpretation. When I hear, and let me just say this on a personal note, I know Barack Obama. Some of you like him, some of you don't. But to think for a moment that this president would deny health care or kill off senior citizens is insulting and it is outrageous. No, it's not funny. The idea that there are so-called death panels that will deny coverage to children who have Down syndrome is totally insane. Tom, it doesn't exist. It never will exist. Believe me. But let's not suggest that, or that kids with disabilities are not going to get health care. That is...
Why is it in writing, Bernie?
It's not in writing. That is absolutely not true. I think we proved this afternoon something that makes us all very proud, is that we live in a state where people can have different points of view, and yet we can listen to each other and we can treat each other with respect. Grassroots democracy and town meetings thrive in the state of Vermont. Thank you all very much.